In conclusion, this study shows that the treatment with EGCG decreased the oxidative stress and improved the vascular function of SHR, which in parts contribute to the decrease in blood pressure of the animal. So that's the end of my sharing. Thank you for your attention.
Thank you, YUCINDA, for your presentation. I would like to invite Prof. Tahe to ask a question.
Yeah, thanks for the presentation. So I didn't see exactly what is the, the toxicity. Have you done the toxicity level for ECG, whatever your drug is?
Good afternoon, doctor.
Yeah, can I know, have you done the, the toxicity test for your drug which you have chosen?
No, you mean the EGCG, right?
Yeah.
No.
So, I mean, then how can you be sure that the amount you have taken is supposed to be not toxic?
Because it's based on the several previous study through the literature reviews showing that the concentration that I use is giving the best result. So
and
that
the drug you're using is supposed to be a plant extract, is it?
It's a natural product, yes.
Yeah, natural plant extract.
Yes.
And did you do the extraction, is it?
No.
It is not done by you?
Yes.
Then, so you have bought the plant product, is it?
Yes.
And, okay. So you have bought the plant product, and have you actually, what I mean to say is like, you still need to do the, the toxicity studies for your drug, in a sense that since you are not using, I mean, you don't know exactly what is the source of the plant, of the product. So probably you should be doing a toxicity test to ensure that even your product, which is claiming to be ECGC, is actually the same product. So have you done any kind of analysis to claim that the product you are using is the same product which is supposed to be?
No.
Then how can you say that it is ECGC, whatever your drug is? You need to know exactly if you say you are using losartan, so you need to do some kind of analysis to ensure that it is losartan, isn't it? Whenever you receive a sample, you need to ensure that the sample is supposed to be supposed to have the same thing which exactly you're supposed to do. Yeah.
Okay, doctor.
Okay, so just a point to be noted. That's all. Thanks.
Okay, thank you.
All right, thank you, Prof. Tahe. Thank you, YUCINDA. So let us move on to the subsequent presentation by Tong Leng from the University of Malaya.
Good day, everyone. I'm Leng from University of Malaya. I'm here to share you part of my study entitled The Role of MER1345P in 7-ketocholesterol-induced human aortic endothelial cell dysfunction. Our previous study reported the deregulation of MER1345P in young patients with acute coronary syndrome. Therefore, the role of MER1345P was further investigated in endothelial dysfunction. Firstly, the endothelial damage, which induced by 7-ketocholesterol, was investigated through several parameters here. Endothelial cell growth was inhibited by 20 microgram per ml of 7-ketocholesterol in HAEC. The calcium ionophore A2317 was used to activate eNOS by upregulated phosphorENOS in HAEC. However, 20 microgram per ml of 7-ketocholesterol inhibit the phosphorylation of eNOS in the presence of A2317. This indicates the endothelial damage by 7-ketocholesterol. The increment of E-selectin and downregulation of B-catecholamine by 7-ketocholesterol indicates the endothelial barrier disruption by 7-ketocholesterol in HAEC. In addition, 20 microgram per ml of 7-ketocholesterol significantly upregulated MR1345P in HAEC. The eNOS inactivation by 7-ketocholesterol, as shown earlier, was ceased in the presence of MR1345P endogamia in HAEC, and this indicates that involvement of MR1345P in eNOS inactivation by 7-ketocholesterol. AKT phosphorylation of activated by 7-ketocholesterol in HAEC, and this was reversed in the presence of MR1345P inhibitor. This suggests that MR1345P regulates AKT activation in 7-ketocholesterol-induced HAEC dysfunction. ITGP1 was predicted as potential target gene of MR1345P and played important role in maintaining normal endothelial cell polarity. Inhibition of MR1345P in HAEC upregulated ITGP1 mRNA level upon treatment of 7-ketocholesterol. In conclusion, MR1345P is involved in the induction of 7-ketocholesterol-induced HAEC dysfunction via AKT activation. Thank you.
Okay, thank you for your presentation. So Kin Leng, you are here?
Yeah, yes, I'm here.
Can you tell me, Prof. Tai, you have any questions for Kin Leng?
Yeah, it's just like what exactly I feel is there are a lot of jargons in your poster. That's one. Okay, so sometimes with such a short frame of time, we'll not be able to follow what exactly has been written because a lot of jargons are there. So probably you need to expand those. Number one. Then number two is like how your research is actually benefiting the present research. I mean, I don't see any comparison.
Okay. Firstly, I use 7-ketocholesterol to induce an endothelial damage, which is already well reported by others. But in my study, my 7-ketocholesterol induced model actually it show upregulated of MR1345P, and this indicates the involvement of this mRNA in the process of the endothelial dysfunction, and it might involve in the progression of arteriogenesis.
Okay, but is there any comparison exactly what is existing now and what your research is going to improve the existing research? Correct? How your research is going to improve the existing research?
Okay.
So what I see in the introduction is that you claim that further investigation is required, and even your conclusion also says that the further investigation is required. Correct. You see the introduction. Okay.
Because the introduction, this is a continuous words from my previous work, like from the patient sample. So we found MR134 deregulated from patients with acute coronary syndrome, and we might want to look at the downstream mechanism that might involve by MR134 in endothelial dysfunction. So up until my result here, it shows AKT activation involved activated by MR134 in endothelial cells induced by 7-ketocholesterol. But how is it? Is it a direct activation, or it involve other proteins or mechanism? It still need further investigation.
Okay, thank you.
All right, thank you.
All right, thank you all. Let me check the next presenter. Is Padmavathy here?
Hello, good afternoon.
Oh, you are here. All right.
Yeah.
So our next presenter here is Padmavathy.
Yes.
And she is from UniKL, Royal College of Medicine, Perak.
Hello, this is Dr. Padmavathy. Today I am presenting a poster on correlation of height and BMI with the motor nerve conduction parameters in both arms of young adults. 60 young adults were involved in this study aged between 19 and 21 to establish the normal data of the nerve conduction study of both nerves, that is median and ulnar nerve. Because these two nerves were involved in the carpal tunnel syndrome, usually they go for the compression and affecting the nerve conduction study parameters. According to the study, the electrodes were placed on position. You can see the photograph. The electrodes were placed accordingly for the ulnar nerve and median nerve studies, and the nerves were stimulated at 2 points, one at the point of the elbow and at the point of wrist. The parameters obtained at the level of the elbow were the proximal parameters, and the parameters obtained from the distal parameters are from the wrist level. You can see the values of the latencies and the peak amplitude. That is the mean values of these two nerves on both sides. The latencies at the level of the elbow, that means the proximal latencies were higher than the distal latencies obtained from the wrist level. The peak amplitude were higher at the level of the distal stimulation than on the proximal side. The conduction velocity were calculated based on the latency differences and also the distance between the 2 points of stimuli. And then the right side showed the lesser conduction velocity than the left side. The left ulnar nerve showed the highest value of conduction velocity. The height and BMI correlated well with the proximal latency and the conduction velocity of the median nerve, but the conduction velocity of the ulnar nerve correlated only on the right side. The height correlated well with the proximal latency on the right side of the ulnar nerve, and also the BMI correlated well with the ulnar nerve on the left side. So this is the end of the recording. Thank you.
All right, thank you very much. So, Prof. Tahir, you have any questions to the presenter?
Yeah. Thanks for the presentation, Dr. Padmavathy. The only thing which is, you say that there is correlation, but probably I don't see any statistical, validation for the existing correlation. It's just there is a conclusion which says there is a correlation, but that correlation is supposed to be statistically validated.
Yes. Yeah, actually, I have done the Pearson correlation using SPSS. Actually, it is showing the correlation between the height and BMI to the parameters of proximal latencies and also to the conduction velocities. But the distal latencies, it did not show any correlation, and especially the conduction velocity is shows the significant differences. So only the left side ulnar conduction is much better than the other nerve conductions. So this correlation, based on that, the significance which I have taken is p-value less than 0.05 as a significant 0.05 is taken as a significant value, and it is correlated with the height and as well as the BMI separately, so that only the proximal latencies showed the correlation with the height or BMI.
So apart from Pearson correlation, you haven't used anything else?
No, I haven't used anything else.
Do you think that you should be using something else to validate your results?
So I'm planning to do the extensive study of many subjects with various age groups, so that I can get a normative data, so that it can be clinically applicable for the patients who come with carpal tunnel syndrome at various age groups. So that's what my future plan to do.
Okay. So, and the second thing that, did you ascertain that your data is normal?
Yes. So I have verified with the previous published studies. So it is correlating almost with the normal studies of other countries of the world.
No, I mean, okay, never mind. Then the second thing is, like, since you are using an intervention, it's a public is involved,
yes,
and you're using some kind of intervention. So I didn't see any ethical approval also for your study, which is
actually this is one of the clinical experiment. I mean, a practical we used to do among the medical students. So it is conducted among the medical students only at present now. So if I apply to the public, to the other people, I will apply for the.
But even you should be having your own ethical committee.
Yes, I went through the ethical committee. They said apply they approved because since it is being conducted as a practical session, so I got the informed consent from the students before I conduct the study.
Those things should be in your posters, because it looks like the ethical approval has not been sought for. Yeah, so it looks like the ethical approval has not been sought for. So because you are involving human, then probably ethical consideration are prime important. Yeah. Okay.
Yes.
Thanks. That's all.
Thank you.
Thank you both. Maybe I give Prof. Tahib a couple of minutes so that he can enter the scores.
Okay. Actually I'm using a rough sheet now, so I'll pass it to you all once I done. Okay.
All right. All right. So let's just move on to the next speaker. Tan Siang, yeah, from the KBJ Healthcare University College.
Morning to 34th MSPP Scientific Meetings 2021 committee members. My name is Associate Professor Dr. Tan Siang. Today I would like to present my research entitled Influence of Knowledge and Attitude in Quality of Life Type 2 Diabetes Mellitus Patient from Private Specialist Hospital in Malaysia. So below are my team members. Problem statements and objective. Diabetes is a major health concern in Malaysia. The current prevalence in Malaysia is about 3.6 million of the individuals in Malaysia are suffering from type 2 diabetes and the complication. So in 2025, the prevalence of diabetes will be increased to 33% of the people aged above 18 years old. Lack of the knowledge, awareness, and negative attitude towards the diabetes are one of the factors on the increment of the prevalence of morbidity and mortality in diabetes complication. And thus, the objective of this research will be to evaluate the influence of knowledge and attitude towards quality of life of a patient, type 2 diabetes patient in private specialist hospital in Malaysia. So we are using the cross-sectional study for this research. And then from the result, we can see that Malay will be the majority of the antic, and the hypertension will be the highest comorbidities. And from the result, we can see that the male participant have a significant poorer attitude, and 47.5% patient had used insulin before. And there was no significant associations of patient knowledge and attitude towards diabetes. So as a conclusion, there was no association of knowledge and attitude with quality of life in the type 2 diabetes patient. And this research may be useful for optimizing diabetes care of commitment preparation approach in maintaining high quality of life score, as well as minimizing the morbidity and mortality rate of chronic disease. Thank you.
Okay, thanks for the presentation. So you mean to say that your study doesn't come with a conclusion that there is any significant association between the knowledge and attitude and diabetes management among your respondents? Is it like that?
Yes, Prof. Tahir. Okay, good afternoon to Prof. and Prof. Tahir. And based on these 80 participants, the findings from there, so there was no significant associations between this knowledge and attitude towards the quality of life among the diabetes patients. So perhaps maybe this will be confounded by some limitation of this small sample of our participants. So I mean, at the beginning, we thought that we will run to include 374 participants, but due to this pandemic, we only can use this Google forms. So there is some, I mean, not well respond from the participants. We only can get 80 participants. Yeah.
Just to check, did you conduct a pilot test before you wanted to go for the actual survey?
Yeah, we actually conducted 20 participants as this pilot test. Yeah.
And the pilot test, your Cronbach's alpha value was supposed to be, validated. Is it like more than 0.7, 0.8? Your alpha value? Your alpha value? Yeah. I mean, I didn't see the alpha value actually.
Yeah. I mean, for this test, retest, validation test, right? Well, we didn't include in this pilot test. For this validation test among the pilot participants, we only to check the validity of the questionnaire, the content validity only. Yeah.
So it was the content validity, or because still you need to come up with an alpha value. So if you come up with an alpha value, probably your items and your things will be much more manageable, and that will be reflected in your actual survey. Probably if you could have included that, the alpha value, and then your survey could have been more manageable. And the second thing is, like, you had 80 participants. So your target was 374, isn't it? You said your target was 374. So may I know exactly how did you come up with a conclusion of recruiting 374 individuals?
Actually the calculations of the sampling, right? We are using this Daniel equation, the Daniel equations. Yeah. Okay. So we will look into this. Prof. Tahir mentioned, so about the alpha value. So this is one of the limitation.
Okay. So probably, and how many questionnaires you had initially? The items which were supposed to access the knowledge and attitude.
The attitude.
How many items? Yeah. How many total number of items?
About 10 questions.
10 questions. So if you have 10 questions, probably you can assume that the sample size should be 5 times of your number of items. So that is the assumption. So probably I think
5 times.
10 questions, like 50. Yeah. So okay, that's all. Thank you.
Okay, thank you for your comments.
Okay, thank you. Thank you very much. So maybe I give about a minute now to Prof. Tahir to key in the scores.
Good morning, ladies and gentlemen.
All right. Our next speaker here is Jer Robinson from Mauritius.
Good morning,
ladies
and gentlemen. Good afternoon. Yes, I'm here.
Good.
I'm Jared
So
Robinson.
let's play your video clip.
From the tropical island of Mauritius. Today, the title of my post is A Qualitative Study of Health Professions and Medical Students' Perspective on Success and its Attainment, a study from Mauritius. The objective of our study was to use success as a baseline to understand a better psychosocial insight into individuals and mediate interactions there in between. As success is an internationally understood phenomenon as well as concept, no matter the background, level of education, or the race or creed of an individual, everyone understands what success is. The methodology which was employed was 20 interviews were carried out by the use of a descriptive phenomenological study, 50% from staff and 50% from students at the medical college. The transcription of these recordings was undertaken, and data analysis was undertaken via Enviva Plus software, which was used until saturation was achieved, thereby producing the results. And 6 nodes were generated therefrom, namely satisfaction, accomplishment, action, motivation, extrinsic factors, as well as intrinsic factors, as we can see in this diagram and schematic above. Now, the wonderful thing about the results which generated is that it then produced the themes and birthed the themes of products of success, mechanisms of success, as well as concepts of success, thereby not only just producing the perspective of students and staff, but also showing us how to actually physically achieve success, a cookbook recipe, if you will, namely the products of success. What is the product of success? How will you know that you've attained it? The mechanism of actually how to attain success and the concept thereof. And in conclusion, a demarcation was therefore noticeable between the preconceived general idea and the actual impression of success between students and staff, and thereby providing a rich psychosocial and emotional viewing glass into our students and staff at SSR Medical College. Thank you very much.
Right, thank you. May I ask a question?
Yes, sir. Good afternoon.
Yeah. Why do you think your research is relevant to this conference?
All right. So in terms of relevance, when we look at success, it started off as a very basic study, just to simply get the perspective and the perception of success at our university. And as it developed and as the data came in and we went through everything and we generated the nodes and the themes, we saw how almost a recipe for success, was brought about. And thereafter, we also saw that the university of success, in terms of no matter your background, creed, or whoever you are, everybody has somewhat of an understanding of what success truly is. And in terms of being able to take this and then apply it onto a larger scale with further study, we're hoping to hopefully one day get to the stage where we can almost produce a sort of code book where one, by just simply getting a definition of somebody, asking any plain man off the street what their definition of success is, how one can then, almost unlock the hidden potential within that person, because you would understand how that person, the psychosocial, being of that individual and where they generate their thoughts, their feelings, as well as how they view the world through a simple question. That's where we're trying to get from here. So it's just the initial study at our university and gives a very small microscopic, of this microcosm that we're in. But the results were, outdid our initial expectations, if that makes any sense.
How would it advance the field of physiology and pharmacology?
Pardon?
How would your research advance the field of physiology and pharmacology?
So with regards to, again, physiology and pharmacology within students, I'm looking at it from an educational perspective, right? We've got lecturers that are 40, 50, 60, some 30, 40, 50, 60 years old. We've got students that are 18 to 25. Sometimes there can be difficulties within, breaking ground between student and teacher relations, both in the setting of pharmacology as well as physiology in terms of a medical education perspective. And if we're able to understand, especially at international universities like the one I'm currently at, if we're able, where everybody's coming from different backgrounds, if we're able to, almost understand individuals from a, quick way of understanding individuals, we can then ease and break through those barriers in terms of education, within physiology, pharmacology, in any medical field.
All right. Were you originally from Mauritius?
No, I'm not. No, I'm actually a South African.
All right.
Yeah.
Prof. Tahir, thank you very much. Prof. Tahir, you have any questions?
I just would like to go to the content. And may I know exactly how you came to a conclusion of those 6 nodes? You said there are 6 nodes. So
Yes.
how you came to a conclusion of having that 6 factors?
All right, how they came all together. Okay, so what we did was we did both using Enviva software. So we used obviously a semi-structural open-ended questionnaire. We ran a pilot on that and validated via 3 experts. The pilot was with 5 students and then 2 faculty members. And then once we had kind of found our questionnaire footing with that, we then made minor modifications and then used purpose sampling technique, and then did, 50% students, 50% staff. And what we did was we then used Envivo Plus software, as well as then went each of the authors went separately and went through each sheet and made, and brought about their own themes, as well as using the software. And then we all sat together in a conglomerate and had a big meeting. And for something to either be accepted or, left out of the study, it had to be in agreement and accordance of everyone. So that's how we generated motivation, accomplishment, satisfaction, extrinsic, intrinsic factors and actions, was from the true content. And what we initially set out, what we thought the outcome would be versus what the outcome truly was totally two different entities in itself. Obviously, if you look at age, we thought younger individuals would have a different view. Elder, lecturers, if they have life experience, would have a completely different view. And to a large degree, if we could sum up all our findings in terms of what the individual said success truly is happiness. That's where it all came together.
So you mean to say that the data collected during the interview was brainstormed within few individuals, and you came up with a conclusion of those 6 factors?
It was both brainstorm and we ran it through Envivo software plus software.
So may I know exactly if the software was able to validate all those 6 nodes? And if
my
yes,
understanding
exactly,
that yes, it was validated.
But I didn't see any validation, any validation in your poster.
It will probably be on the main study. This is just understood.
Yeah, if there
next time to add it in.
Yeah, like example, if you could have at least run maybe a factor analysis, maybe a Barrett test, maybe KMO. So probably it could have been, much more better for us to
understand.
To conclude it. Anything which is validated by the software should be there on, on the poster. Yeah, that's all. Thank you.
Thank you.
Okay, thank you very much.
Thank you very much.
Perhaps I give a minute for Prof. Tahir to key in the score. All right, now let's move on to the next poster presenter, Norazirah Nayan from University Technology Mara.
Yes, I am here. All of you. I am Norazirah Nayan from Faculty of Medicine, UITM. Here I am going to present my findings where we investigate how the exposure of plastics and resins compound called as BPA towards pregnant mother can affect its offspring neurodevelopment. In this study, NMDA receptor subunits which are GLUN-N2A and GLUN-N2B in the hippocampus as well as the learning and memory during adolescence were investigated. Pregnant spratlolites were used in this study and they were divided into control and BPA groups. The fetus and adolescent rats were utilized for ELISA and neurobehavioral tests which are open film and Morris-Waterman's tests. According to our findings, the prenatal BPA exposure significantly reduced the level of GLUN-N2A and GLUN-N2B in both fetus and adolescents hippocampus when compared to the control groups. Thus, at adolescent stage, such effects have shown to cause anxiety-related behavior and increase error in navigation ability of the rats in the neurobehavioral assessments when compared to the control groups. In conclusions, the prenatal BPA exposure induced learning and memory impairment when reaching adolescence due to the changes in the level of NMDA receptor subunits. That's all from me. With that, I end my presentation with thank you.
Right, Prof. Tahir, questions from your side?
Yeah, thanks for the presentation. May I know why did you add a twin AT to your formulation?
All right, thank you for the questions. I added twin AT to my formulation because we use twin AT as a vehicle to increase the absorptions of the BPA inside the rats. Yeah, it is as a vehicle.
Is it as used as a vehicle because the vehicle is supposed to be water, and
Sorry?
twin AT vehicle is supposed to be water, isn't it? You're using water also, am I right?
Yeah, RO water.
Yeah, RO water is the vehicle for you, the solvent.
The solvent.
What is the actual application of twin AT?
Yeah, like I said just now, twin AT is actually work with the BPA to increase the absorptions of the BPA from the gastrointestinal tract into the blood vessels. Yeah.
Yeah, that's why I mean why it does so. Why twin AT does so?
Because twin AT has the structure of the twin AT is compatible with the BPA that it can act as her vehicles. The chemical structure of the twin AT.
Twin AT actually is a non-ionic surfactant.
Yeah.
Okay, and the non-ionic surfactant tend to have a better compatibility in terms of absorption.
Yeah.
Right. And that is the reason, probably what I assume you're using twin AT. And since you're using neuropharmacology, probably twin AT is one of the good choice, so that it can actually allow the substance to cross the barriers. Yeah. So it's a surfactant which actually opens up the barriers,
Yeah.
That's why we use it. Yeah. That's all. Thank you.
Thank you.
All right. Thank you very much to both. I give Prof. Tahir a minute to key in the score. All right, so now let's move on to the next presenter, DATU AGASI bin Muhammad Kamal from the Department of Physiology, Faculty of Medicine, University Kebangsaan Malaysia.
Hello everyone, my name is AGASI. My study is a preliminary study of Keluluthani effect on ovarian histology in letrozole-induced polycystic ovary syndrome rats model. Polycystic ovary syndrome is the leading cause of anovulatory infertility. The pathophysiology of PCOS is including hyperandrogenism, oxidative stress, and chronic inflammation. Keluluthani is stainless bee honey with anti-inflammatory and excellent antioxidant properties. In this study, we used Sprague-Dawley rats treated with 1 mg per kg per day letrozole for 21 days to induce PCOS. This rat then will be confirmed to develop PCOS by estrous cycle irregularities. And then this PCOS rat will be divided into 4 groups, which will be treated with distilled water and 3 doses of Keluluth. Another 2 group is control group, which is treated with distilled water throughout the study, and PCOS group, which will be treated with 1 mg per kg per day letrozoles for 21 days. The rats will be sacrificed and we will do H&E staining on the ovary. This is the result. This is the atretic follicle, cyst, and the corpus luteum. We found that with 1 mg per kg Keluluthani, the corpus luteum increased significantly, indicating an increase in ovulation rate. The PCOS in this group has the most cysts, indicating that PCOS induction was successful in this study. However, we couldn't find any difference in atretic follicles and antral follicles between all groups, although the Keluluthani group show a trend of improvement in both parameters. These distortions of coprolutria in the Keluluthani groups indicate renovations of estrous cycle to normal functions. Hence, this preliminary study is provide a good foundation for further study. We conclude that with 1 mg per kg per day Keluluthani showing the most potential in inducing ovulation assessed through increasing the count of corpus luteum. Thank you.
All right, thank you very much, AGASI. Prof. Tahir, you have any?
May I know exactly, like for your research, you're using honey. So probably if there is any present literature which says that this particular honey which you're using is also having significant effect, which is similar to your study?
Yeah. Can you hear me, bro? Hello, can you hear me?
Yeah, can.
Actually, there is previous study that doing the research Keluluthani on the sperm in the Sprague-Dawley rats. So they were found that this Keluluthani is giving a beneficial effect for the sperm motility and other parameter. But as I know, there were no previous study that doing Keluluthani on female reproductive study. So my study is the first study that doing on this female reproductive system.
But what prompted you to think like that?
Sorry?
What actually prompted you to think like that honey will also be having some kind of positive effect on?
Yeah, because on the first study that using Keluluthani on male reproductive, and then I found another study that this Keluluthani is giving benefit on insulin resistance, which is related to the PCOS, which is my own study now. Yeah, so I've in addition to the anti-inflammatory and antioxidative, which is the pathophysiology of the PCOS. So I choose the honey for this reason.
Yeah, I think that there is one study, because it's not my area, but there is one study which refers to that royal bee honey having some positive effect on PCOS. So there is a study, probably if I'm not wrong, royal bee honey having certain positive effects on the same issues. So maybe you can refer it for your further conclusion.
Thank you so much, Prof. Thank you.
AGASI, I have a question. I just wonder why you use Kelulut, because there are many different types of honey. Why your interest is in this Kelulut?
Yeah, because we have doing a review that comparing between the Walang Kelulut and Gelam honey, which some study they were telling that Kelulut honey having the most antioxidant value. So because other Walang and Gelam, people are doing it on female productives, but no one is doing Kelulut honey on female, so that's why I use it. Yeah, in other, because of the antioxidant properties is found to be high compared to other Malaysian honey.
Do you think you should include other honey as a positive control in this case, since people have done it before?
Yeah, actually, this is a preliminary study, but now we are continuing this study by having a positive control on metformin and clomiphene.
Okay, thank you very much.
Thank you, Prof.
I give Prof. Tai a minute to key in the score before we move to the next one.
I've done.
All right, thank you. So now let us move on to the next presentation. Okay, so our next speaker is Najla Shakirah binti Abdul Halim from Faculty of Medicine, University Kebangsaan Malaysia.
Assalamualaikum and hi everyone. My name is Najla Shakirah binti Abdul Halim from Faculty of Medicine, PPU KM. The title of my poster presentation is Polygonominus Inhibit Tumor Necrosis Factor Alpha-Induced Endothelial Cell Migration. Angiogenesis is implicated in disease such as cancer and atherosclerosis, and the endothelial cell migration plays a significant role in angiogenesis, which is mediated by growth factors and cytokines, including basic fibroblast growth factors and tumor necrosis factor alpha. In this study, we choose Polygonominus or daun kesum, a herb commonly used as flavoring agent in Malay delicacies. Previously, Polygonominus extract was reported to have antioxidative, anti-inflammatory, and antibacterial activity. However, their anti-angiogenic effect is not yet investigated. Umbilical cord was collected from consented patients, then HUVEC was isolated, cultured, and divided into 5 groups of treatment. Subsequently, scratch migration assay and determination of BFGF level by ELISA was performed. Dexamethasone was used as positive control in this study. Result shows that Polygonominus significantly inhibit migration in TNF-alpha-induced UVEC, possibly through nuclear factor kappa B pathway. Secondly, inhibition of migration in TNF-alpha-induced UVEC was not accompanied by decreased level of the FGF as expected, thus suggesting that the inhibition is not mediated by the FGF pathway and may involve other pathways such as VEGF. As a conclusion, the inhibitory effect of Polygonominus on migration suggests its potential as anti-angiogenic agent. However, further studies are needed to elucidate specific pathway that cause this inhibition. Thank you.
Yes, Prof. Tahir.
Yeah. May I know exactly what prompted you to think that the plant Polygonominus will be having this anti-angiogenic effect? What prompted you to think so?
Okay, doctor. Because actually there is previous study that reported about it's not Polygonominus but Polygonum species. There are various Polygonum species that has anti-angiogenic properties such as Polygonum hydropiper, Polygonum cuspidatum. So that this Polygonum minus it was reported to have anti-inflammatory activity, but the anti-angiogenic effect is still not yet investigated. So that's why in our study we try to evaluate this anti-angiogenic effect.
Is that the only thing which prompted you to think so that it will be having anti-angiogenic effect? Or there is any other criteria you should be looking into before coming up to a conclusion that it will have some kind of effect? Have you done the phytochemical constituent test? What are the constituent, the chemical constituent?
The phytochemical constituents of this Polygonominus?
Yes.
It has a presence of flavonoids, essential oil, sequiterpene, miniterpene.
The voice is breaking, is it?
There is a reported that phytochemical studies that showed this Polygonominus, it shows that it presents of flavonoid and essential oil. But
so did you went through the extraction process for Polygonominus?
No.
So you did not do the extraction, is it?
Did not do the extraction. So we use the standardized aqueous extract of Polygonominus that contain the quercetin, triglycol.
Aqueous extract.
Aqueous extract, yes.
And it contains quercetin. So did you establish that it contains quercetin? Quercetin is a flavonoid, isn't it?
Yes.
So did you establish that it is having quercetin?
You mean
It's okay. I mean, normally you should be, you know, once we do an extraction and we are able to classify the phytochemical constituents. So example, we come to a conclusion that it is flavonoid. So it will give an idea exactly this particular plant will have an antioxidant effect. Got it? So based on the chemical constituents, we can actually claim, and it will give an idea exactly what kind of effect it will be having. And since it is having an antioxidant effect, it is bound to have anti-angiogenic effect. So that is what exactly we will come to a conclusion. Yeah, that's all. Thank you.
Okay, thank you, Dr.
All right, thank you. Thank you very much. So I give Prof. Taye a minute to key in the score before we move on to the next one. All right. The next presenter is Sohaib Ashraf from Sheikh Zayed Postgraduate Medical Complex, Lahore, Pakistan.
My name is Dr. Sohaib and I'm working as a cardiologist at Malaysia General Hospital. Today's topic of discussion is role of honey and Nigella stevia against COVID-19. COVID-19 is a global pandemic when we all have been suffering from this pandemic. And so basically we devised honey and Nigella stevia, which has antimicrobial, antiviral, anti-inflammatory, modulatory properties. We use these two products against COVID-19. It has also shown anti-COVID properties as well in silico studies. So in order to know the clinical efficacy, we devised a clinical trial in which we recruited moderate to severe COVID-19 patients as a multi-center survey, and we included 313 patients for the purpose of this study, and we given them 1 gram of honey and 80 mg of Nigella stevia per kg body weight in 2 to 3 divided doses over a period of 24 hours. And the results were quite alarming to us as well, that the honey and Nigella stevia patients were having a earlier viral load clearance, around half of it took around half time the difference in the moderate and as well as on the severe cases. If we have a look at the alleviation of symptoms, which was measured by the decrease in the symptoms, resolution of symptoms, it was also marked difference between honey and Nigella stevia group and placebo group, and same was the case with moderate and severe cases. If we have a look at the oxygen saturation, it was increased dramatically in honey and Nigella stevia. However, in the standard of care, it was not that much pronounced. As long as the honey and Nigella stevia also showed at 7-pointers score that the patients progressively took a longer period of time in treatment for honey and Nigella without honey and Nigella stevia. So future goals and conclusion is that we need to come up with an idea to use honey and Nigella stevia against COVID-19. Thank you.
Yeah, Prof. Tahe, you have any question?
Yeah, I mean, this looks quite appealing, that a probably combination of honey and Nigella saliva is supposed to improve the outcome. So may I know exactly what was the primary outcome and the secondary outcome for your study?
Well, the primary outcome was viral load clearance, and along with that, it was the alleviation of symptoms. That was the two primary outcomes, and in the alleviation of symptom, we basically used time taken for the alleviation of symptoms, one parameter, and the other parameter in the alleviation of symptoms was the clinical grading that was done on the basis of WHO criteria. That was a 7-pointer score from 1 to 7.
And you're comparing with a standard care, isn't it?
Yes, it's basically it's not it's sort of an adjunct therapy where we are giving standard of care to the both arms, and we are giving honey and Nagella stevia to one group and placebo, which was basically an empty capsule, and we were giving to the other thing. So we are basically comparing both of these arms along with the standard of care.
And your result was like the primary and secondary outcome both were improved, is it?
Yeah, they basically when the clinical trial was started, let me tell you a little of the time that when it started, because you have asked a very good question in this regard. So when the clinical trial was started, it was in the March and April in 2020, when there was no really known basis, and in silico studies was done on Henny and Nagella stevia that was showing promising results, but there was no clinical evidence was available, and no in vitro studies were really done. And but we because of the previous studies that was on SARS-CoV-1, along with that the studies that have proven its anti-inflammatory, antimicrobial, antiviral properties, all of these properties were shown in various studies previously. So we started to use this as a therapy against COVID-19, and fortunately it came out to be a very promising results, and both primary and secondary outcomes were improved.
And if you could have also highlighted the possible reasons for it, and then the conclusion would have been much better. Exactly what kind of mechanism of action actually is happening, because you said that you have already checked all the 7 guidelines what exactly WHO has already framed. So how and why it is happening, it would have been much better if you could have shared.
Yeah, thank you so much for asking this question, because during my presentation, when I was giving it within 2 minutes, I was really afraid that I'm not really elaborating and elaborating everything that I want to do in regard to the mechanism of action, because there is established fact about the antiviral properties which has already been done again in asthmatic patients in the use of Nigella stevia, and there is use of antibiotic effects of honey has already been established, especially in the diabetic foods we are using for ulcers. And anti-inflammatory immunomodulatory properties are also being shown. Cough for the treatment of as an antitussive, honey is being used as the first line drug in NICE guidelines, which is basically which is a first line drug of choice for cough in NICE guidelines as per NHS, basically, which is being used in European guidelines. So they are using this, and in the mechanism of action, they are inhibiting viral proteins of SARS-CoV-2 as well, and thymoquinone is also playing its role in that as well. So but another added advantage to all these individual mechanism of actions of individual components of honey and Nagella stevia, like thymoquinone and nigelladine and methylene glycol, all those there is basically the effects that are being produced by the synergy of these components. That is a very productive effects, and along with that the anti-diabetic effects, anti-hypertensive effect, the properties that is having as an anticoagulant, antiplatelet, because we all know that during COVID-19 the patients that we are seeing nowadays have mortality because of sepsis, which is basically because of the superadded infection. We have the diabetic patients whose mortality is more. We have obese patients whose mortality is more. We have patients with hepatic and renal failure, which is because of complication of COVID-19. And one more thing that I want to highlight is the hypercoagulable states, like myocardial infarctions and stroke, all the thrombotic events. It's also covering all those sort of events as well as anticoagulant, antiplatelet properties.
Okay, so
thank you so
that's
much.
Fine. That's all from me. Yeah.
Thank you. So may I know where do you obtain your honey from?
Well, we basically used natural honey, and we verified it and tested and standardized it by the help of pharmacologists and pharmacists and botanists. We have a panel which was standardizing all the honey and Nagella stevia, which was professor of botany. There was a panel which includes pharmacologists, pharmacists, and botanists. That was basically using we were basically giving samples to test the standardization and purity of the honey.
Okay, were the bees from like native to Pakistan?
Yes, true. Yeah,
I see.
It was done from the Swat side. The honey was from Swat. It's basically a region in Pakistan.
Okay, so perhaps you can like maybe do like in the future you may want to do some comparison with Malaysian honeys, because we have different types of honey too, like what the previous speaker said.
We are basically taking a step ahead towards prophylaxis part of it. We have registered it with clinicaltrials.gov. The prophylactic use of honey and Nagella stevia against post-exposure COVID-19 participants who have got exposure towards COVID-19, and we are giving that as a prophylactic agent. And we do believe that the collaboration between Malaysians and Pakistan, because in this study we have intellectual collaborations with Massachusetts General Hospital, as I'm working at Massachusetts General Hospital right now. There was collaborators from University of Montreal, which was from like Canada. So we are really into collaborations, because this is a global pandemic and we all need to come up, because this is something, a disease of where we can also, we can treat the patients with like it's a layman remedy, natural remedy for a natural remedy.
Okay, thank you very much for your interesting talk.
Thank you.
All right, so next speaker is Vigneswary Thiruselvam from International Medical School of Management and Science University.
Palm oil have many medicinal uses, as they are rich in many nutritional values. Because it's becoming one of the most worrying conditions among women in reproductive age because of its complication. Because affects about 5 to 10% of women in reproductive age in Malaysia, therefore the current study is intended to identify the effect of red palm oil in improving letrozole-induced PCOS in rats. 40 Sprague-Dawley rats were divided into 5 experimental groups, and the research intervention was carried out for 28 days. The estrous cycle of the rats were monitored before and after 21st day of the research. The BMI of the rats were recorded once a week, and the anxiety level of the rats were evaluated using elevated T-Maze test. The raw data of the research were analyzed using SPSS. The study shows that the low-dose red palm oil shows a decrease in BMI at the end of the pre-treatment. However, it was not significant. Meanwhile, high dose of red palm oil shows an increase in BMI at the end of the research period compared to low-dose group. This shows that the antioxidant present in the low dose of red palm oil can have beneficial effect in reducing BMI of the rats despite its fat content. Meanwhile, the rats in all RPO treated groups showed an irregular estrous cycle compared to control group. This gives a hypothesis that the fat content in red palm oil might play a role in estrous cycle of the rats. The rats in red palm oil treated groups showed a longer time to explore the open arm in the elevated T-Maze. Therefore, they showed a higher level of anxiety compared to control group. The red palm oil did not show any significant effect in improving the anxiety level of PCOS rats. In conclusion, red palm oil might show an effect in dose-dependent manner. Therefore, further study using different range of dose of red palm oil should be done to identify the maximum effect of the antioxidant present in red palm oil in improving PCOS.
All right, thank you very much. Prof. Tahir, you have any questions?
Yeah. My question will still be the same as the previous candidate. Like, why did you conclude that red palm oil may have an activity against PCOS?
Sorry, doctor, come again?
what actually prompted you to think, in a sense, that red palm oil will have an activity against PCOS?
Okay, from the previous studies, I can see that red palm oil is very rich in vitamin E, especially a lesser common form of vitamin E, which is alpha tocotrienol. As you all know, vitamin E has several forms, right? So red palm oil specifically has less common form of vitamin E, which is alpha tocotrienol. And vitamin E is known to play progesterone-like effect in PCOS, and it also will reduce the negative effect of androgen in PCOS. So eventually it will improve the symptoms of PCOS. So that is why I chose red palm oil as the natural therapy to improve PCOS.
And you said that you have to increase the dose, isn't it?
Sorry, come again, doctor?
Is it like you said that you need to increase the dose to have the desired effect?
Increase the ranges of dose, because I only used two different doses for this study, because since I'm an undergraduate student and we didn't have much time to conduct the full research, so unfortunately we couldn't do optimization for the dose, so we had to choose the dose based on the previous study, and that is why I said that we need to increase the range of doses in the future study to actually identify the effect of antioxidant in red palm oil to improve the condition in PCOS.
Okay, but red palm oil is an unsaturated compound, isn't it?
Yes.
And probably once you think of increasing the dose of an unsaturated compound, it will bring a lot of unwanted effect.
Yes, doctor.
So I don't know exactly how you can cope up with those unwanted effects, because unwanted effects sometimes are too much unwanted.
Yes,
so yeah, because the dose is supposed to be calibrated in such a way that you don't invite all those unwanted effects in your study. Yeah, that's all.
Yes,
thank you.
Thank you.
All right, thank you. So move on to the next one. The next presenter is Shakirah Othman from University Kebangsaan Malaysia.
Hi, I'm Shakirah Othman. My poster presentation entitled Polygonominous PM reduces angiotensin converting enzyme ACE and angiotensin 2 in human umbilical vein endothelial cells (UVEC). In Malaysia, around 6.4 million people suffer from hypertension, with an estimated spending of 1.5 billion ringgit alone for the treatment. This signifies that hypertension is a serious condition and imposes significant burden to society and economy. It is well understood the significant involvement of oxidative stress and overactivation of renin-angiotensin system RAS in the pathogenesis of hypertension. In RAS, ACE and angiotensin 2 are the key proteins that play important roles in the regulation of blood pressure. Previous literature has elucidated the antioxidative effects of PM, but none is known for its antihypertensive activity. Thus, the study attempted to explore the potential antihypertensive activity of PM via its effect on ACE and angiotensin 2 levels in UVEC induced with formal myristate estate PMA. The cultures of UVEC were divided into 5 groups that consist of control, UVEC induced with PMA, UVEC treated with PM, UVEC induced with PMA and treated with PM concomitantly, and a positive control of UVEC with captopril. Then ACE and angiotensin 2 protein level were measured via ELISA after 24 hours of treatment. As shown in figure 1 and 2, treatment with PM alone did not result a significant change in ACE and angiotensin 2 protein level in comparison to the control. As expected, PMA significantly increased the protein level of ACE and angiotensin 2, elucidating the hypertensive model in vitro. Subsequently, PM significantly reversed the PMS action, as demonstrated by the reduction of ACE and angiotensin 2 protein level. The study concluded that PM reduces ACE and angiotensin 2 levels in PMA-induced UVEC, thus demonstrating its potential antihypertensive effect. I would like to thank our team in Physiology Department UKM for their collaborative efforts in finalizing the study. Thank you.
Yeah, thanks for the presentation. So may I know exactly, you have used like 200 micrograms to 400 micrograms of your extract, isn't it? And have
Yes.
you done a toxicity study that the amount you're using will not be toxic to the body?
Yes. For cytotoxicity study, we already tested aqueous extract of polygonamines up to 500 microgram per milliliter for 24 hours in HUVAC, and we found no reduction in viability and no significant changes in cell morphology. So we concluded that there's no polygonamines had no toxicity effect.
So 500 microgram is your ceiling dose, is it?
Yes.
Okay. And you're using an aqueous extract, probably
yes.
thinking that the aqueous extract will have quercetin, because quercetin will have this kind of effect. Is it like that? Quercetin
yes,
is supposed to be cardio. Yeah. Quercetin has some cardioprotective effect. Yeah.
Yes, because it has antioxidative and also ACE inhibitory actions.
Yeah, but like, why are you taking an aqueous extract? Because quercetin, the quantity of quercetin can be increased if you go for an alcoholic extract.
Okay. By the way, according to the Christopher et al. 2015, either aqueous or ethanol or methanol extract have been reported to possess high antioxidant potential compared to synthetic antioxidant. And then for the purpose of medical study experiment using herb extraction, one of the key is that all extraction solvents should not have toxic effect to living cells, animal, and also human being. So that's why I use the aqueous extract.
Okay. That's all. Thank you.
Thank
all
you,
right,
Prof.
thank you. So our last speaker here is HILWANI ISMAIL from University Kebangsaan Malaysia.
Atrophic vaginitis is characterized by the thinning and drying of the vaginal epithelia. It is a major response to hypoestrogenism, a deprivation of estrogen characteristic of genitourinary syndrome amidst developing menopause. General complaints associated with atrophic vaginitis includes itching, burning sensation, vaginal discomfort, pain and burning when urinating, dyspareunia, and blood spotting during intercourse. It is often accompanied by urinary tract complications. These manifestations crucially impair the quality of life and results in discomfort and anxiety in a woman's sexual life. Current therapeutic options for atrophic vaginitis include systemic and topical hormone replacement therapy, the use of selective estrogen receptor modulators, vaginal androstenedione, use of lubricants and moisturizers, as well as non-drug therapies. This study aims to provide evidence for the efficacy of galam honey as a potential apitherapy in augmenting atrophic vaginitis by enumerating the effect of galam honey on vaginal epithelial thickness and serum estradiol levels. Galam honey was administered to sexually mature female Sprague-Dawley rats divided into 4 groups. Rats received oral doses of galam honey at 0.1, 1, 2, and 8 grams per kilogram body weight for 2 weeks. Blood samples were taken from retroorbital plexus, and rat vagina was collected for histopathological analysis. Galam honey administration was found to increase mean thickness of the vaginal epithelial layer and level of serum estradiol. Both parameters recorded the highest values in the group receiving galam honey at 2 grams per kilogram body weight. In conclusion, the estrogenic effect holds potential for galam honey apitherapy to be considered as a potential component of managing genitourinary syndrome.
All right, good. So perhaps I pass this to Prof. Tahir.
Yeah, thanks for the presentation.
Thank you, Dr. Tahir.
Yeah, like you're using honey.
Yes.
So honey, I mean, and you say it's a pilot study.
Yes.
So is it like that there isn't any study reported with your honey or maybe of similar kind of product?
Okay, so currently in Malaysia, we have a few types, in Malaysia, we have a few types of honey where we have the multifloral honey or the monofloral honey. So usually now there is extensive use of tualang honey for research, but there is still limited research going into galam honey because it has a lower nutritional value as compared to tualang honey. But looking into galam honey would actually increase the natural product for Malaysia, for the price natural product for Malaysia. So we're looking into gelam honey specifically in terms of the effects on female reproductive system.
Okay, so probably like maybe in future you need to compare with the existing honey and their effect, and then your honey and maybe your effect. Yeah.
We are actually comparing with another group studying tualang honey in UTM, which is by Zaid et al. So there is that comparison, but this one was to actually just report on the preliminary findings.
Yeah, it's good. Yeah.
Okay.
Thank you.
All right. Thank you very much. So I guess that's all for this session. I thank all the presenters for your hard work, and you all have done a really great job for this to prepare for this conference. I believe you have spent a marvelous amount of time to prepare your posters, and some of the posters are really impressive. I also like to thank Associate Professor Dr. Tahir for his valuable time to spend with us this evening. And also, yeah, can we have a photo session with the judge, Prof. Tahir, and also with all the presenters here? Would you mind to turn on your camera, please, for the presenters?
Okay, so I'll be taking your picture. Okay, everyone smile. Yes, 1, 2, 3. Okay, perfect.
All right, so thank you very much. Thank you for joining us today. So I hope you enjoy for the rest of the conference. Thank you. Bye.
Thank you. Bye.